So yeah, um, it's my privilege to talk about researching the infodemic. And obviously this is an illustrious group of people doing a lot of original research. So, I wouldn't pretend to have to cover everything. And there are, nuances, and everyone has their focus on specific nuances. So I apologize in advance that if I do not mention your favorite nuance, because there is limited time available. What I would do is I would give a few examples, and the idea is to start and nudge us towards thinking from a consequentialist perspective in a pandemic. And so the examples are intended to serve as illustrations, and obviously, as I said, they are not at all a comprehensive list of questions that you could ask, and the comprehensive and perfect methods that you could use to addressing this pandemic. There are two ways of looking at how we generate knowledge, how we address our problems. One is a more deontological approach, that the appropriateness of our actions, including actions related to research, are independent of their consequences. Good research is good research. Whether it has application right now or not, it's independent of that. And that's a pretty legitimate perspective. For example, people who were looking at zebrafish biology were not thinking that it would become the model for regenerative medicine, one of the more exciting models for that. People who were looking at heuristics initially did not have applications, and the people who were developing some of these insights did not know whether this kind of knowledge would become more prevalent and applied in terms of behavioral economics or behavioral insights or whatever name you want to give that body of knowledge. There's another way of looking at it, which is consequentialism, that what we do is mainly judged by the outcomes that it generates, the outcomes of the activity itself. And I would submit that in a pandemic, where we are dealing with, to quote Martin Luther King, with the fierce urgency of now, that's the imperative we should follow. That's not to negate a deontological perspective.
Saad, did we just lose you? Can you hear us, Saad?
Everyone, can you?
Now we can hear you.
Now we can. We missed the last minute and a half.
Oh. Yeah. So let me switch off my camera, my own camera for a second, because you're already looking at my presentation. Is this clear? Is everything clear right now?
Yes.
Yes.
Okay. So I was saying that there are two ways of looking at human knowledge. One is a deontological perspective, that our appropriateness of our action and our research is good or bad, independent of the impact. But in a pandemic, we should be decidedly consequentialist in the sense that we should focus on the impact of our what we produce, the impact in terms of policy and practice, etc. Because in a pandemic, we deal with the fierce urgency of now. And the result is, the way we apply it, that we start with the challenges and work backwards towards our disciplines, rather than starting with disciplines and saying that how does that discipline fit a challenge. So I'll go through a series of examples, but before that, all our research should be grounded in a few ethical principles. First of all, this is a human catastrophe, and justice should be at the center of not just the policies we generate, but the research the research questions we evaluate. And equity goes hand in hand with the principles of justice, but also we should respect individual agency, not just autonomy, but agency that postulates that people have the ability to make decisions for themselves, but we facilitate those decisions. In certain situations, there are boundaries to, in terms of, there's a conflict between the common good and the individual liberty, but that needle should be thread with a lot of care. And then we should avoid seemingly beneficent paternalism, what I call the so-called knight in shining armor syndrome. So I'll take you through a few things that we are doing in our group as illustrative examples. Again, this is doesn't even come close to the kinds of things people should look at and the kinds of ways they should look at those questions. So the first thing is, how do people mix during and outside pandemics? Often our mathematical models, be it at the group level or at the individual agent-based models, are based on simplistic assumptions about human behavior. And within that, there is empiricism that is largely absent from a lot of those discussions and a lot of those inquiries of going into going into the going into developing policies and models for pandemics and disease control. So we try to address this by looking at a few ways of how humans mix and how their behavior happens in the real world. This could be extrapolated to the digital space. It could be extrapolated to a lot of other situations. And we looked at, we had projects already that we reoriented towards the pandemic around the workplace, the home, and now the latest one that started with healthcare workers. And the way we are doing this is by tagging people with consent with RFID, asking them to fill out their diaries of social mixing in a sense, who they came in contact with, but also why, and what is their behavior. And so the good thing is that we set up at least the first two projects earlier on before the pandemic. And these were not the first projects in this area. A lot of models are populated by this really nice study called the Polymod study, which was done in 8 cities in Europe, but it was done in 8 cities in Europe. It wasn't done for specific situations. It didn't have a focus on individuals under 6 months of age. It did not use sort of more newer methods of looking at contact, and it did not have detailed behavioral data. So we are doing that. And our specific focus is, well, for one of our studies, the household studies, is 8 locations in low-income countries, low and middle-income countries. And on the right-hand side these are the contact matrices that look like, that come out of these kinds of studies to say that who's coming in contact with whom. But we will enrich it further. We are enriching it further with actual behavior data and motivational data. So that's one example. The second one is, what is the vaccine acceptance of COVID-19 in various populations? And this is the example from the US population. And we found that even now, and it's not too early to think about it, we started thinking about it back in February, because having done this, it was, I thought that it was naive that people were talking about that since this is a pandemic, since everyone is scared of the disease, automatically people will start accepting this. So we did a few things, and this is one example. We looked at the US data, and reasonably representative data, but the granularity was at the regional level, not at the state level for this data collection exercise. And we found that there was a lot of heterogeneity in vaccine acceptance that we could expect when the vaccine becomes available based on the current situation and the current attitudes using standardized scales. But we also said, look, from a consequentialist perspective, we would need to better target our messaging, better target our communications approaches. So we have started building these models that take the behavioral data and then look at the demographics and the background of those people. We will continue to enrich it through other kinds of data sources like consumer behavior and so on and so forth, so that when the vaccine becomes available, we are not flying blind. But this is the time to talk about developing mass level tools for interventions. There's a whole body of work that I'm not going to go into that a lot of people are working on in terms of vaccine acceptance, which is relevant here, but this is just one example. The other one is, can we optimize COVID-19 vaccine distribution. There has been a lot of issues in terms of PPE distribution within various countries. There are issues of justice and equity, but they also feed into a lot of perceptions of trust in government, trust in authority, trust in even technical recommendations. So can we decouple that, and can we start thinking about optimal models of distribution? So we used, with a mentee of mine who's a quantitative geographer, we worked at different data sources that are already available, and this is an example from the US. We plan to do that for multiple countries and globally as well. And we looked at different priorities of ways of prioritizing vaccine acceptance or vaccine recommendations. And there's already a lot of thinking about who should get the vaccine or not. And there are certain groups that come up in those kinds of discussions. For example, the elderly, the healthcare providers, especially those who are high risk, and those with comorbidities, and so on and so forth, and then essential workers. So we did various indices separately for different policy goals, but also computed an unweighted overall vaccine priority score. And on the left-hand side, it shows that this is where in the US you would have to place the vaccine, and you should start preparing county by county where the vaccine should be available, so that that's an objective way of distributing the vaccine, but also a way of increasing and sustaining trust in public health advice and public health authorities. The other was on the right-hand side is the differential, the difference between our approach and the raw population distribution. So you can't assume, and the ones on the right, on the two coasts of the US are the most densely populated areas. And you can see that even, especially in those areas, there is reasonable difference between what is, where you would have placed the vaccine just based on population allocation, and a more nuanced approach. The other things, what else we can do in terms of from a values perspective, I showed that this slide in my previous talk about values that, according to the moral foundations theory, underlie a lot of our, they are deeper than our attitudes and certainly deeper than our behaviors. That's one way of looking at it's one worldview of the world that you can use to put some order around how you talk to people while being mindful of their values. And we know that these values in many contexts, this slide is from the US, you can have people with their different political inclinations don't have just political preferences, but have different moral matrices, liberals, conservatives, and libertarians, for example, in the US context, and this has been replicated in other places. Again, this is one way of looking at the world, one imperfect way of looking at the world that have different sets of values that cluster together. And so if you begin to speak to people's values, there are other ways of doing this as well. So working with our colleagues in political science, our Dean of Humanities here at Yale, plus Chair of Political Science, Alan Gerber and Greg Huber, respectively, we have been testing messages. For example, we are looking at treatment messages around social distancing, and then there will be other behaviors that we are testing. For example, there's this bravery messages that have shown promise in certain fields. And for example, you say that it's not cool, it's not brave for you to be out there and you are putting others at risk. So emphasis on not being brave, because that came out in some of our and other people's data that people want to look macho in this kind of a situation and say that it's a sign of weakness. And then we are testing it with the pollution message that you are helping create a toxic environment for others. And that maps back to the purity foundation that, that is part of the moral foundations theory. Then the other sets of messages we are evaluating are normality messages, with the return to normal as a motivation, but return to a new normal as another motivation, as an intervention message. And then, so these are categories of messages. The comparisons is to sort of different controls. I'm not going to go into the detail of that. And then looking at another axis of self-interest with communitarian interest, but also framing it as a threshold effect or a linear effect, that if you get to a certain level of communitarian behavior, you induce protection versus a linear function. So we did that in an initial study so this is an initial study using a somewhat Bayesian framework to select the next, do one trial, and then do the next trial for the messages that went out in this trial. And so we found that the messages that were most promising for all say social distancing behaviors that we evaluated, like overall scale, but also for food behavior scale, that whether you're willing to sort of order in food, etc. Obviously, it's modified by your economic status, or take other precautions, persuade or evaluate others in terms of social norms, and then overall beliefs about and norms about social distancing, etc. All of them point to a specific direction where a cooperative behavior, where sort of everyone works together and should reduce risks to others if everyone cooperates to practice social distancing without necessarily a threshold effect, without saying that it's a linear phenomenon, it's a linear framing. Then the other one that looks promising is, again, not bravery, not necessarily with pollution, to say that if you're not brave, you don't practice social distancing. This is not an act of bravery. Obviously, the message is a lot longer. Then there's this other issue of directly addressing behavior. So this is interesting, somewhat controversial, but still worth paying attention to. So Noel Brewer, a health behavior person, guru, as well as sort of a few other people from health communications as well as psychology, got together and did this mother of all review of interventions to increase vaccine coverage, particularly with a sort of a psychological component to them. And so they use messages, included things such as messages that increase disease risk appraisals, all the way to vaccination requirements and incentives. And what they found was they categorized them by the level of evidence available and the likely impact they could have. And turns out that one of the more impactful interventions that they found, and they, knowing knowing the group, they didn't start with vaccine requirements as their preferred approach. Turns out incentives and vaccine requirements, as well as structural interventions such as on-site vaccination, as well as in healthcare provider level communications, come out to be the top ways of increasing vaccination coverage if you do sort of look at it more systematically. So vaccine, that requirements sometimes translate to the term vaccine mandates. That has come out to be sort of favorable in a lot of situations. That's not the panacea for all situations. And there should be boundaries around that intervention. So myself, Cornelia Bech, and Julie Lees came up with this framework where we say that if countries are going to consider mandates, and how we think, I'll come back to why we are talking about mandates in the question of COVID-19. I'll talk about that in a second. But if you are considering it for any vaccines, you ensure, first of all, that everyone can access vaccines. And that's true for other interventions around COVID-19. Ensure stable supply of vaccines, make clinics welcoming, and monitor vaccine safety. Then you use, if you want to use vaccine requirements, use it as part of a multi-intervention package. And then the last thing is, if you are going to implement it, ensure that procedures are fair, make penalties appropriate, compensate for side effects, and avoid implementing selective mandates. And so when you do that, first of all, it should be used sparingly, only in places where step 1 and 2 can be guaranteed. So, and if it's implemented, do it in a way that it's judicious and takes a moderate approach, a behavioral approach, by changing the balance of convenience rather than being too draconian about it. So we, a few of us have started thinking about policy interventions to increase ensure vaccine uptake. because some people's behavior impacts everyone's behavior, everyone's risk factor. And if you want to resume some sense of normalcy after this pandemic, we will have to have high vaccination uptake, especially in high priority groups. And so it's one way of thinking about it. It's too premature to think about things like immunization requirements and policy intervention. The other way to do that is that if we don't start thinking about these approaches, politicians often, when they don't find other options, default towards more sort of legal interventions. So we wanted to have an honest discussion about it, and we came up with 6 triggered criteria for vaccination mandates. It's framed around the US, but has implications for other situations as well. This should be read in the context of the previous Nature, the framework we proposed in the Nature a couple of years ago, or last year, I guess. But essentially for COVID-19, first of all, it's not adequately contained in the jurisdiction. There has been a recommendation. The supply of vaccine is sufficient. Available evidence about safety and efficacy is communicated. And then there's an infrastructure to provide access to vaccination without financial or logistical barriers. And then in a time-limited evaluation, voluntary uptake of vaccination among high priority groups hasn't been accomplished. And so this is coming. And so if we are going to be talking about these kinds of things, even with this kind of a middle of the road approach, it will have implications on the infodemic that is around vaccines. And then value of multi-tiered interventions. I'll give you an example of this kind of an approach that CDC delivers, where it says that both digital and real life tools, such as assessment, feedback, incentive, and exchange, are used for vaccination coverage. And I think these kinds of interventions should be considered for all sorts of interventions around COVID-19, be it masked or compliance in healthcare settings, in corporate settings, in sports teams, and so on and so forth. So I'll skip the next slide and I'll stop here. I've been saying this in the context of universities, but it is true for the larger research enterprise, which is that we have a privileged positions in civilizations because we are the guardians of knowledge for future generations. What we produce right now, what we are learning right now through science, through experience, through policy, we will pass on to our students, our mentees, and specifically future scientists. Thank you.